Thank you very much for joining. This is the 7th seminar in our MED webinar series, and today we are talking about delivering integrated curriculum online. What we want to achieve during this session is that everybody attending this webinar will be able to explain the concept of integration in the curriculum, identify different levels of integration in the curriculum, draw a timetable of an integrated module, although it seems not very big thing, but when we'll see, you'll see the importance of it. Deliver the contents of integrated module online, and finally assess the students based on the principles of integration. So let's start with the concept of integrated curriculum first. And this definition is, I found, the most comprehensive definition of an integrated curriculum. A fully synchronous, transdisciplinary delivery of information between foundational sciences, means basic sciences, and applied sciences throughout all years of a medical school curriculum, right? So it is synchronous, it is transdisciplinary, it is between the basic sciences and applied sciences, and it is throughout the curriculum. So that is a very comprehensive definition of integrated curriculum. Another definition: the organization of teaching matter to interrelate or unify subjects frequently taught in separate academic courses or departments. So basically, integration brings together different departments, interrelate their teaching learning activities. And a third definition, which is more of a practical definition or for implementation, the teaching of different subjects areas in a thematic manner, so that the different disciplines are not emphasized, and we will be talking quite a bit detail about the development of themes and how to implement them. This is another definition by GMC. We strongly favor true integration of the course with horizontal and vertical, using the term in the sense of interdisciplinary synthesis and not simply coordination or synchronization. So this thing, the coordination and synchronization, would also be explained in a short while. Now, coming to the horizontal and vertical integration. So basically two types of integration. Horizontal is information taught in the same curricular phase. For example, integration between the subjects taught in the preclinical phase only would be a horizontal. Integration between the clinical sciences only would be horizontal integration as well. But vertical integration is where both there is integration between clinical and basic sciences. If you see this diagram on this side, in the vertical integration, the clinical input starts from the very beginning, and basic sciences keep on contributing even towards the end. So there is no zero or no point where none of them is contributing. This, when we think vertical integration, some kind of clinical input starts from the day one, and the basic sciences keep on contributing till the end of the course. I'll be talking about 5 principles of integration, and they are really, really useful to understand and implement, and based on the ground facts. The first one, integration focuses on key issues. That is done that promotes learning in context. For example, clinical scenarios. Even the basic sciences lectures or discussions can be started with simple clinical scenarios. Adopts holistic approach and focuses on core curriculum, that is must know knowledge. That is the minimum requirement without which a student cannot progress to the next level. So a minimum standard is set when we are applying integrated curriculum. Enhances construction of knowledge through integration of basic and clinical sciences, deep understanding of new concepts. It promotes understanding and the comprehension rather than rote memorization. Identification of gaps in knowledge and search for answers, use of resources. A good example is problem-based learning, in which students identify the gaps in their knowledge and then they go and search for information using different resources. Application of newly acquired knowledge to solve problems. Case-based learning is best example, where students apply their newly acquired knowledge in a totally new or novel situation and applying to solve those problems. Promotes application of knowledge to real life solutions, learning through problems, as I mentioned, problem-based learning or case-based learning, using knowledge gained to solve new problems. I've given the example of case-based learning, getting feedback and improving the learning. And then is the fourth principle is critical thinking and lifelong learning skills, which is achieved through generating hypotheses. For example, in problem-based learning sessions, students are required to generate hypotheses, interpreting data, searching for evidence, making decisions, especially in case-based learning where students have to make decision about the diagnosis or the management, finding relationships and identifying differences. And next one is enforces staff development. Of course, when we are implementing a new approach, it requires staff development, improving teaching skills, mastering new techniques, learning how to give constructive feedback, enhancing evidence-based teaching, keeping high standards, and achieving excellence in areas of expertise. So these were the 5 basic principles on which the integration, the concept of integration is developed. Now, next is the levels of integration.
What is integration? It's your integration curriculum. Oh,
may I request, please keep your mics mute. So the levels of integration, this is the concept which was introduced by Professor Harden, that integration is a continuum. In the SPICES model of educational strategies, integration is presented as a continuum with full integration at one end and discipline or subject-based teaching on the other, and of course with intermediate steps in between. So he identified 11 levels of integration, starting from isolation, awareness, harmonization, nesting, temporal coordination, sharing, correlation, complementary, multidisciplinary, interdisciplinary, and transdisciplinary. We will be talking about some of these levels. In these 11 levels, the first 4 steps of the ladder, they emphasize on subject or discipline. Then following 6 steps emphasize integration across several disciplines. And the final step, where the student takes more responsibility for the integration, is given tools to do so. Now, talking about the first level of integration, which is labeled as isolation or fragmentation or anarchy, where there is no consultation with others. I think those uh, participants who have gone through traditional medical schools would be very familiar with this. Students attend a lecture on anatomy and then move on to lecture in physiology, with neither lecturer being aware of what was covered in the other lecture. So there is no connection between the two subjects. Department or subject specialists organize their teaching without consideration of other subjects or discipline. For example, anatomy may start with musculoskeletal system, physiology with cardiovascular system, and biochemistry may be with renal system. So there is no coordination at all. Each discipline or each subject is going in their own way. Each discipline looks at the curriculum content in terms of areas to be covered, depth of coverage, sequence, and timing from the perspective of their own discipline. So every discipline is interested in their own content and the coverage. No attention is paid to other related subjects or disciplines. The relationship between subjects is not explicitly covered, and related topics from two disciplines are not intentionally correlated. There might be some unintentional correlation, but there is no conscious effort to do that. Each subject is seen an entity in itself, and the objectives are seen as mastery of the object, of the subject. For example, anatomists want their students to be anatomists, and physiologists want their students to be physiologists. So everybody is interested in their own discipline. So this is the fragmentation. There is no coordination, there is no integration at all, and that is the way at least I was taught in my medical school. Now, next, let's go jump to integration level 5, which is temporal or coordination, parallel teaching or concurrent teaching. This is what the GMC definition was mentioning. Here, each subject remains responsible for its own teaching program. However, the timing of the teaching of topic within the discipline is done in consultation with other disciplines. The timetable is adjusted so that topics within the subject or disciplines which are related are scheduled at the same time. Similar topics are taught on the same day or week. For example, physiologists teach the function of the heart at the same time when anatomists are teaching the structure of the heart. So there is some coordination, some integration between the disciplines. So when they prepare the timetable, they consult each other and start on the similar areas. Students study the concept of different subjects separately and are left themselves to uncover the relationship. So although the timetable is coordinated, the subjects are being taught parallel, but what is the relationship between the subjects, the students have to understand themselves. The next level, which is sixth level, it's the sharing or joint teaching. In this level, the two disciplines may agree to plan and jointly implement a teaching program through the joint sessions. Overlapping concepts or ideas make the basis for shared planning and teaching. Students are shown the relationship between the two disciplines as compared to level 5, where students are left to figure out themselves the relationship between the discipline. In joint teaching or sharing teaching, the students are shown this relationship. For example, a joint session between pediatrics and obstetrics, talking about infant of diabetic mother, whereas the obstetrics would be talking about the diabetes in a pregnant lady, and whereas the pediatrics would be talking about the infant of the diabetic mother and its complications. Or obstructed labor and birth asphyxia can be another example. Community Child Health Program being run jointly by the Department of Child Health and Department of General Practice means when we are teaching the students about the community child health, these two departments work together. And another example is parasitology and pharmacology run a joint session on malarial parasite and anti-malarial drugs. So this is a sharing or a joint teaching sessions, which is by the sixth level of integration. The next is the correlation commitment program or democratic program where subject-based are there, but on top of that, there are some combined sessions, assignments, or for example, problem-based learning sessions. So in seventh level of integration, the main input is through problem-based learning sessions. The emphasis remains on disciplines or subjects. Within this framework, an integrated teaching session or course is introduced in addition to the subject-based teaching. So subjects keep on teaching at their own, but there are some integrated sessions like problem-based learning to bring some integration into the course. Another example of correlation apart from PBL is multidisciplinary seminars or symposiums. And the assignments given to the students is designed to integrate the subjects. For example, prepare an immunization schedule. So students have to learn immunology, infectious disease incidents, and the ability of the child to pick up that vaccination. So there are multiple subjects are involved in that assignment. Whereas in symposium, there's one topic, for example, I was talking about malaria. So the multiple departments can contribute in one symposium apart from parasitology, the clinical disciplines and pharmacology. Of course, problem-based learning sessions are there. The next level, which is the complementary program and the mixed program, this is where the major component or major part of the curriculum is covered by the integrated sessions. And most important component here is the theme. Identification of theme and teaching under the guidance of theme makes a big contribution in integration, and we'll go into a bit detail of this. How to develop a theme. For example, we are talking about a module of hemopoietic, hematology, or lymphoid module. And then we identify the major contributing disciplines as far as basic sciences is concerned. For example, we expect the physiology to contribute significantly, biochemistry, pathology, and pharmacology. And then we ask each discipline to identify the first three topics they would like to teach in this module. And invariably, we would come to a situation where physiology want to teach hemopoiesis, biochemistry, structure of hemoglobin, pathology, anemia, and pharmacology, iron therapy. And if we want to discuss all these things, they can be discussed under the theme of anemia. So anemia can cover all these. So basically, it's a backward approach. We ask the concerned disciplines to identify the topics, and then we find the right theme which can cover all those topics. So if by following this example, our theme of the week becomes anemia, and then this is an example of a timetable under the theme of anemia. Now, one thing in this timetable, first thing is to identify that this is a very comprehensive timetable. Each box can tell you the whole information. For example, if we talk about this box, we know that this is the module. This is a biochemistry lecture 1. This is the location. This is the discipline, and this is the lecturer. And of course, time and day is given. So this is a very comprehensive timetable which can be built under the themes, and you can get whole information in just one glance. You don't have to look so many places to get all the information. So that is one. And now we see that under the theme of anemia, all the different disciplines are contributing the whole thing to anemia. For example, here is normal hemoglobin, an overview. Then is the physiology is teaching hemopoiesis. Again, blood grouping by physiology. Pathology might be talking about hemolytic anemia and like abnormal hemoglobin or hemoglobinopathies, right? And then the PBL sessions are also based on the same theme, and even the practicals, the interpretation of peripheral blood smear would be on the same area, and even epidemiology would be looking at the anemia. So if we have a theme, we can bring all the relevant disciplines within that theme, and that would be a very good example of integration. And if you see here, the departments are not being emphasized, are not taking any prominent place, but the most important thing is the theme of the week, where every discipline is contributing. Now, in the same level, if we want to assess the students, the examination would reflect the emphasis on both integration and subject or discipline based. For example, using modified essay questions, structured essay questions, problem-based questions, or extended matching questions, they will all be focusing on integration in the curriculum. Another area could be assessment during small group discussions, for example, during problem-based learning sessions, or assessment of the students during joint sessions. So it is both subject-based and integrated. The next level is multidisciplinary or webbed. A multidisciplinary approach brings together a number of subject areas in a single course, with themes, problems, topics, or issues as the focus for students. Courses are developed around body system. I'm sure all of you are aware nowadays that the modules are being developed around the body system, such as CVS, gastrointestinal system, or CNS. But just imagine if we can bring the same structure in clinical years. In preclinical years, we are developing or dividing our curriculum on modules. So if we bring the same structure to clinical years, for example, rather than having a pediatric posting or a medicine posting or surgery posting, we have a posting of cardiovascular system. And different disciplines or specialties are contributing towards that. This is the concept in level 9. Now, my experience is up to level 8 in our medical schools in Malaysia. Most of the schools are going up to level 8, not more than that, because it's a bit cumbersome to develop, and apparently it's a big change to implement so fast. But this is a good thinking point, that if we have the modules which we have in preclinical years, can we apply the same modules in clinical years and bring different disciplines or specialties to contribute towards that discipline. The other way could be, one is body systems. Another suggestion is that dividing the curriculum under the stages of life cycle. For example, from the conception to birth to a child to an adolescent and adulthood, so an elderly and death. So that is another concept, rather than dividing or implementing the curriculum under different modules. They can be arranged according to the stages of life cycle. Themes may be combination of information and skills which are relevant to medicine, such as tasks, ethics, or health promotion. Now, the final level, or the 11th level of integration, is transdisciplinary fusion or immersion or authentication. Here, the curriculum transcends the individual disciplines. There is integration in the field. The curriculum in the first 3 years of the students' studies is integrated around the body systems, and the last 2 years, students are attached for periods of time to a range of specialties in the hospital and community. For example, the last 2 years in Dundee, Scotland, the whole clinical component is divided into 113 clinical problems or tasks, and students work on that going through different disciplines rather than they have the specialty postings. For example, there a task about abdominal pain. Those students would have a surgical perspective in surgical attachment, and then different perspective in medical or gynecological or general practice. So the whole thing is based on these 113 clinical problems, and where students go through that, and depending upon which area they are posted at that time. A printed or electronic study guide is a key element in helping the students with the challenge of integrating these different experiences. It's not easy to implement, and of course we need a very comprehensive study guide to implement the whole 113 problems and the students following that in different disciplines. Another example is in South Dakota, where integrated clerkship is in ambulatory care setting. That is, the clinical years are spent in multidisciplinary clinics. So there's no one specialty, but there are multiple specialties running a clinic, and students go through that. So this is the final, where actually there is no single discipline or department involved. It is multiple disciplines involved, and it is being implemented only in few medical schools. Right, now that was the introduction and the concept of integration, and then the different levels of integration. And as I said, that my experience are most of the medical schools in Malaysia, they are going up to level 8 or 9, not more than that, because they find it difficult to implement after that level. Now, methods of delivery of integrated curriculum. Joint sessions, which I just mentioned, and giving the examples of obstetric and gynecology and pediatrics, or pharmacology and parasitology. PBL sessions, I think most of us are familiar with that, because in one PBL session, multiple disciplines contribute, so the integration is maintained. Case-based learning sessions, I'll give an example in a short while, and modified essay questions. They are two, in fact, very effective ways of implementing integrated curriculum and easy to teach also. Themes I have just mentioned, the common lectures are symposia or webinars. Early clinical exposure, it's again a part of integrated curriculum. The preclinical students are brought to the clinical side or to the hospital or maybe to the clinical skill lab where they get some clinical exposure based on the module they have been going through. Assignments can be used to integrate multiple disciplines or subjects, and the projects or videos can be used also to implement integrated curriculum. And the vertical module like personal professional development and ethics can also be used to integrate the curriculum. Now, that was implementing integrated curriculum face-to-face. Now, how to conduct the online integration? For example, we'll start with joint sessions. So joint sessions can be in the form of webinar. Pediatrics and ONG can contribute together, or ONG and psychiatry, for example, peripheral psychosis, the two departments can contribute. Surgery and physiology for intestinal obstruction, pancreatitis, mainly looking at fluid and electrolytes. That was joint session. Now coming to problem-based learning, it has been shown that the problem-based learning can be conducted successfully online. Face-to-face and synchronous online tutorial group sessions are comparable in terms of process of problem-based learning. The few steps which we need to take is first to organize face-to-face meeting to allow online students to get to know one another. Then identify the supporting sessions that can be delivered online, and reach an agreement on rules for online sessions, and make sure that the visibility and regular feedback in online sessions. So basically, if we are using Zoom, we can use the breakout room facility, and I think many other softwares have this facility of dividing the students into small groups, and that can be conducted very successfully online. The four key principles of student-centered learning in problem-based learning, that is, the learning should be constructive, self-directed, collaborative, and contextual, can be achieved through its online conduct quite successfully. I was talking about case-based learning, and again, case-based learning can be conducted very successfully online. Here is an example of a case presentation. A 5-month-old boy is brought to the accident and emergency department with difficulties in cyanosis. There is history suggestive of respiratory tract infection, which is fever, nose, cough, and decreased feeding. Then on examination, the child is crying, irritable, and appears drowsy, has rapid and deep respiration. His skin appears dry, and he has deep central cyanosis, and conjunctivae appear deep red. Auscultation of the chest reveals a soft systolic murmur in the pulmonary area. Lungs are clear. So this is a case scenario or a case presentation, and it's projected online, and then students are asked certain questions. For example, what is the most likely diagnosis? And they have to justify their answers. There are a number of questions which can be generated from this case presentation and asked from the students. And those questions can be from very different disciplines, thus bringing in the integration. Some points, for example, explain the mechanism of sudden increase in cyanosis, discuss the role of fever and decreased feeding in precipitating the episode of increased cyanosis, state the most likely cause of drowsiness, why patient develop rapid and deep breathing, why the conjunctiva appear red, and why the murmur has become softer. So all these questions can be discussed online with the students, with their participation, and lecturer can contribute by answering some of the questions and clearing some concepts. Now, teams, which we discussed in details, they can be implemented very successfully through webinars. For example, we mentioned about the anemia, and maybe, let's say, one seminar we have, or our theme, we have nutritional anemia. And this webinar can be given by the physiology, biochemistry, hematology, pediatrics, and nutrition. So we can have one webinar from for students on nutritional anemia, bringing in basic sciences and clinicians together, and maybe epidemiology as well, and conduct a webinar where all that information can be taught through the students in one sitting. Excuse me. So the webinar can be a very useful intervention if we want to implement integration and use the online facilities. So even when the students are back in the campus, still some sessions can be held through webinars where multiple disciplines can contribute at the same time. Right. Now, that was the basic sciences. Coming to clinical component, of course, there would be a lot of limitations because the clinical component cannot be completely taught online. However, early clinical exposure can be done to some extent through videos and with explanation. Some of the things can be demonstrated online, and then we ask the students to prepare the videos and send back for feedback. I have done on, for example, on examination of central nervous system and given a demonstration and using some pictures to explain to the students, and then I have asked them to prepare videos of their own and share with us. And then we discuss these videos among the peers and the lecturers. I'll show you an example of one. Here is this is the video sent by a student after the cranial nerve examination. But video are yeah. So guys, वहाँ से
So that was the end of your cranial nerve 12, the hypoglossal nerve examination.
Sorry, the sound was
Thank you so much for participating. Okay, bye.
Bye.
right. So that is one example. Sorry, there was not sound for a moment in that, but that was one example where after explaining to the students online the examination of cranial nerves. They tried at their home on their siblings or friends or relatives and made videos and sent back. And then these, with, of course, with the consent and permission of the people who were examined, the videos were shared among the students and discussed in the presence of a lecturer. Right, now that is as far as teaching is concerned. Now coming to the assessment, the theory can be assessed through modified essay questions because they are a very good example of assessing the knowledge in many different disciplines in one go. So modified essay questions are very useful method of assessment and in an integrated curriculum. Problem-based questions, similar concept. Structured essay questions. Extended matching questions is another type of multiple choice questions which can be used quite effectively in assessing the integrated curriculum. Assignments are assessment during problem-based learning sessions, and the vertical modules can be assessed by giving questions in theory papers and interviews online involving simulated patients, for example, talking about ethical issues, communication skills, or taking consent. So these are different ways. So in conclusion, the online plus face-to-face teaching learning, which makes a blended learning, can be very useful in implementation of an integrated curriculum. I think that was the last slide. Thank you very much for your attention. And now, if you have any questions, I'll be happy to answer those questions. So the in the chat box, so one question is, how many units you give on subjects like
Good morning, sir.
ED?
This is Professor Ram from India.
Yes, Prof. Just give me 1 minute. I'm reading the question from the
case. Any problem-based learning is again case-based learning. So any discussion of a case.
You see, Prof. There is a very basic difference between the two. In problem-based learning, students go through the problems, identify the gaps, and go and learn about it. Learn mainly about basics, whereas in case-based learning, they are applying their previously acquired knowledge. So in case-based learning, the aim is to solve the problem by applying whatever they have learned before, whereas in problem-based learning, they identify the gaps in their knowledge and go and learn about it. So there are two different approaches altogether.
I have a question.
Yes,
I'm
please.
Dr. Zahid from Pakistan.
Yes, please.
Which one is better in this form, integration, problem-based learning or team-based learning?
No, basically, if you follow the team-based learning is mainly a subject-based. In team-based learning, most of the time we are doing only one discipline or one subject. So that doesn't bring much of integration. The problem-based learning, we must have multiple disciplines involved. That's why the problem-based learning or case-based learning are much better ways of implementing integrated curriculum.
Thank you very much. Thank you.
Yes, any other questions?
Sir, as you went, sorry, can I ask a question?
Yeah, sure, please.
Sir, my question is, as you told about the case-based learning, but I'm a bit confused between PBLs and the CBL. What is the difference between these two?
Right, okay. Now, in PBL, which is mainly in preclinical years. Yeah, the student, sorry, PBL and CBL, right? Prof. Iram, you are asking about PBL and
And
CBL.
CBL. Yes, sir. Yes, sir.
Yeah. So problem-based learning is where students are actually not meant to solve the problem.
Okay.
They by going through the problem, they are expected to identify the gaps in their knowledge, and then they go back and read about it.
Right.
Whereas CBL is an advanced stage,
Oh,
which is mainly in, for example, in clinical years, but can be in preclinical years as well, that they apply their previously acquired knowledge. They solve the problem there and then. So ideally in CBL, they don't, all their questions are discussed and answered during the sessions, and there is no homework. Of course, if somebody want to go and read about it, can do that. But there are two different concepts. In problem-based learnings, students identify the gaps in their knowledge and they go and read about it. Whereas in case-based learning, they apply their previously acquired knowledge, which may be from the PBL, to solve that problem. So that is mainly the application of knowledge. The strength of case-based learning is application of knowledge, whereas strength of PBL is identifying the gaps in the knowledge and learning about that.
sir, it's mean like in PBL, they are not supposed to make diagnosis and the management.
That, I mean, that is not the main focus. That is not the main focus. So
Right.
to come to a right diagnosis or to come to a right management is not the main focus. That can be part of it, but basically they have to learn mainly the basic sciences related to that problem.
Sir, it's mean we prefer PBL for the preclinical subjects and CBL for the mostly for the clinical subjects.
But generally you can say that, but with a little bit of modification and careful implementation, both can be done in both phases.
Right. Thank you, sir.
Sir, I am Professor Imran from Hyderabad, Pakistan. I'm asking,
Yes,
is there any difference in between the CBL and CBD, case-based discussion?
I think the important is the process. Name can be anything, as long as there is a problem presented to the students, and the problem is the stimulates the students to apply their previously acquired knowledge, and they solve the problem. Name doesn't matter, as long as the process is there. You may have a different name, and we might have a different name, but it is whether it's a case-based learning or some other name, I think it doesn't matter.
Thank you very much, sir.
Thanks.
My question, Assalamu alaikum.
Walaikum
Again,
assalam.
Dr. Zahid, I'm from Shwa College of Medicine.
Yes, sir.
My question is this, that in integration, where we should put research component, because in our medical school, research is being taught from first year onwards throughout.
All right.
How to integrate research in the curriculum?
All right, sir.
Integration. Thank you very much.
We are also teaching the research component in year 1 and year 2. And if you look at the timetable I showed you, under the theme of anemia, now there are certain subjects which are taught related to the theme, but there would be certain subjects which are not related to the theme. So basically in that week, most of the subjects would be related to the theme, but there are, for example, ethics and the personal development, professional development, evidence-based medicine, they would be covered along the way. We also have a vertical module, which we call a personal professional development and ethics, that also covers a research component. In fact, that is a major, very important part of our curriculum. we teach the basics of research in first year, and students are supposed to do a project based on that research, whatever has been taught to them in second year. So it is given a due importance in that, and it runs vertically rather than horizontally.
Thank you very much.
I hope I
Thank you.
answered that question.
Yes, thank you very much.
Good afternoon, sir. May I ask a question, sir?
Yeah, yes,
I'm Dr.
please.
Yes, sir. Sir, with regards to the level 9 integration, level 10, when we were talking about integration into systems like CBS, CNS, and
Right.
other systems, sir, how do we decide the amount?
Sorry, can't hear you.
Yes, sir. I'm sorry. Sir, with reference to the systems like CBS, CNS, RS, etc., how do
Right.
we decide the amount of a component to be integrated between the different disciplines, and how does it reconcile with the credit hours and the number of weeks given for a certain module? Because it sometimes appears that we are missing out a lot of portion in trying to compress and put everything into a system.
I think that's a very, very, very important component, and thank you very much for asking that question. Now, the first thing is that the contribution of each discipline is not equal in every module. It depends upon the module. And for example, when I was talking about this hemopoietic and lymphoid tissue, so anatomy would have a very limited contribution in that. Whereas if it's a musculoskeletal system, anatomy would be having a major contribution in that. So it depends upon the nature of the module that different disciplines would be contributing. So we cannot say that each discipline must contribute equally. Basically, what we do is that once you have decided what subjects need to be taught in under one module, then the different disciplines cover that, and it may be different in different disciplines. But at the end of the year, their contribution would be more or less comparable. So it depends upon the nature of the module. The one interesting thing which we did about what you said about the weeks given. So when we developed our curriculum in one of the university here, and the curriculum committee and people who were developing the curriculum, we asked them, don't talk about the time, don't think about the time, just make a curriculum and tell us what you want to do, and the time would be decided later. Just put your wish list first. And it came out almost the same, which we normally are doing in different curricula. The week may be just 1 or 2 weeks here and there. So if you develop a curriculum without thinking, you just think that you have unlimited time and develop a curriculum, but follow the 5 basic principles of integration, which I mentioned here. Limit yourself to the core knowledge, and then time would not be problem. It was an interesting experience that even without having limitation in time, we actually came up with almost the same duration of the modules.
Thank you, sir. Sir,
Alamshir, can you ask a question, please?
Yes, sir, please. Thank you.
It's Dr. Aslam from Rawalpindi, Pakistan.
Thank you very much for joining, Prof.
Well, thank you very much, sir. Nice to meet you. And there's scarcity of books available on integrated curriculum for every course, for MBBS, for BDS,
Right.
and so forth. So would it be a high time for all the subject experts and the consultants to sit together and start writing books on integrated curriculum according to the systems or module or themes or whatnot? What is your opinion about it?
Thank you very much, Prof. Actually, you might have seen that some books are already in the market combining anatomy and physiology together.
Yes.
The process has started. People have realized the need. But while we are waiting for these books to be available in the market, I think it is a big responsibility of the teachers to talk to each other and uh, devise the curriculum. For example, I think if we follow the themes, I'm really convinced by the usefulness of the themes. If we follow the themes, we can implement integrated curriculum quite successfully, although we are still following our departments, but there can be a lot of cooperation there.
Yeah, thank you.
Sir, coming back, sir, I'm again Dr. Datta here. Sir, coming back
Yes, sir.
to what discussing about this integration.
Right.
Sir, you were saying that curriculum was prepared and given to us. So, who actually gets to prepare the curriculum? Should it be the subject expert, or should it be the medical educationist, or should it be a teamwork between both? And how do we go about giving the number of credit hours? Because, okay, if we remove the time factor and then we make a wonderful curriculum and then see it all fits in, but
Right.
still, how much is the role to be given to the subject expert, the subject specialist? Because if medical educationist is going to do this, there may be incongruency between the two. So, what is your opinion?
Sir, the first thing is, you said rightly, it is a teamwork. It
Yes,
is
sir.
not an individual's work.
Yes, sir.
And the subject experts have to be there, because the medical educationists are not the subject experts.
Yes, sir.
Medical educationists would work as bringing the people together and helping people to coming to the themes, but the content is to be given by the subject specialist. Again, medical educationists might help to identify the best method of teaching, whether it's a PBL or CBL or TBL or a lecture. So the role of medical educationist is very different and not from the point of subject experts. Of course, without subject experts, we cannot develop a curriculum.
Yes,
So
sir.
it is a teamwork, and what happens is that there are permanent members of the team with the curriculum committee, and then there are members on need basis. So some the medical educationist would be, of course, part of the permanent team, but sometimes the subject experts may be invited depending upon the requirement. For example, clinicians might be invited to contribute while we are developing even preclinical curriculum, and
Like PBL,
preclinical
yes.
lecturers can be invited while we are developing the clinical curriculum. So it is a teamwork, definitely.
Yes, sir. Thank you so much, sir. Thank you so much.
Yes, any other questions?
Yes, sir.
Sir,
May
I have a question.
Yes, sir.
Actually, I am Dr. Tigria from UPNM.
Right.
Suppose some medical school is running on subject-based teaching.
Right.
Now they want to upgrade in integrated system.
Right.
According to your talk, there are 11 stages. So,
Right.
and Malaysia have got 8 or 9th level.
Right.
So what do you think from the subject base? Should we straightway try to go the topmost position, or gradually we go one by one? What is your suggestion regarding this?
Actually, it's not difficult to start at level 7 or 8. So you can straight away go by the themes. And very easily, even if you are 100% subject based, once you start working on that and you start putting things under theme, you would already be in level 7 and 8. So it's not difficult, because the just teaching subjects parallel, for example, I was giving the example of cardiovascular system, that the physiology and anatomy teaching at the same time, that is already at level 5 and 6. So going under themes would already be in level 7 and 8, and that is not difficult.
Thank you, sir.
Thanks. Sir, I have a question. I'm from Islamabad Shifa College of Medicine.
Yes, sir.
Sir, my question is that despite our best efforts to integrate content, still there is some content which is very difficult to integrate or cannot be integrated in one module. So a common approach is to make a foundation module by many universities. So is this a good approach in your opinion?
I think that is an excellent approach. There are a number of advantages of a foundation module. One is that you get students from different areas and with different levels of understanding. So foundation module brings the students at the same level field. So, and prepare the students for integration. The students who come to medical schools in first year, they may not be familiar with integrated approach at all. I think foundation module is an excellent idea, and it actually helps in implementation of integration. The different schools might have different duration, but definitely it is a very good approach.
Thank you, sir.
Right.
Sir, excuse me, can I ask a question?
Yeah, sure, please.
So my question is, like, while doing integration, like on level 7, 8, or 9, when we get contribution from different clinical and basic subjects, should these clinical subjects we teach in basic level, or the basic subjects we teach in clinical level, be the part of assessment?
Yes, basically when we are doing the assessment in integrated module, it doesn't emphasize much on the individual subjects. Now, for example, I said the early clinical exposure. If you have this cardiovascular module and you have been teaching students about the cyanosis and the heart sounds, etc. And once in a module, maybe last week of the module, the students go to the hospital and they actually see the patients. How does the cyanosis look like, and how does the heart sounds appear, and how to take the pulse, or maybe how to take the blood pressure, very basic things. So that helps students to understand this. So the other thing is that we should keep in mind that not everything what we teach must be assessed. So basically, as I said, the emphasis is on core curriculum, the basics, the minimum. So there is a minimum standard of progressing the students. Of course, students can go much beyond that, but emphasis in assessment is not on the disciplines. So if clinical, of course, when we are assessing the students in preclinical years, and there is some component of clinical, if we divide, let's say, have questions, questions are modified essay questions, they can be based on clinical scenarios. Similarly, in clinical years, when we are doing clinical scenarios, we can ask basic science questions, especially, for example, on pathophysiology or pathogenesis of diseases. So it can be integrated in that.
Thank you, sir.
Is there any other questions? If none, thank you very much, everybody, for joining.
Sorry, sir. I have another question. Just now you told about the foundation module.
Right.
But so far, I have seen most of the medical schools, they have got the general module, the first module. So is it the same general module and foundation? If not same, please explain a bit the foundation module, sir.
No, it is same whether it's a general module or foundation module. Basically, is giving the students the very basic concepts of medicine. Let's say, for example, in anatomy, different positions of the body. And it covers general, for example, fluid and electrolytes in physiology. So it covers broad areas, not very specific, but prepares the students for the modules coming ahead. So different people give it different names, but there are the purpose is the same.
Same objectives.
Yeah. Now I have just a couple of slides to share with you. The last two slides. Right. The first is our next webinar is on students study guides, which would be conducted by Associate Professor Dr. Rukhsana and Malik, and it would be on 11th of October. So hope that to see you in that webinar as well. And the final slide, the usual one, a request to each participant to donate $1 USD or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in the community. And we make this appeal after every webinar for your cooperation. Thank you very much, everybody.
Thank you, sir.